All right, we are going to get started. This is COVID-19, the road to recovery. It has not been a straight path. It's had all sorts of curves and winds. I want to thank everybody for coming this evening. This is a place to actually get scientific information on all the things that you're hearing about COVID-19 and the COVID vaccine and the COVID variants as we actually attempt to come out of this. My name is Dr. Valda Crowder, also known as Dr. V. And I'm an emergency medicine physician, and I've been an emergency medicine physician for 30 years. I've treated people across 4 different pandemics, 1 mass shooting, and also 2 Category 5 hurricanes. The slides for this presentation are prepared, and some of the documentation is on my website, which is AskDrV.us. All of these are actually taped with today's date, so you know when we actually gave some particular advice, because information is changing all of the time. You can also follow me on Twitter and Instagram, and my handles are at the bottom. All right, let's get started. The structure of the presentation is a slide presentation followed by Q&A. What I'm doing now is I'm adding a topic that is also a wellness topic at the end of every presentation. So today we're going to be talking about COVID update, and we are also going to be talking about kidney stones. All righty. If you, everyone's in listen mode, you can ask a question either using the chat icon or also using the Q&A. And I will read the question and answer it to the best of my ability. Depending upon the number of people, we can sometimes take live questions. It just really depends, but everyone will be in listen mode during the actual slide presentation. All right, so let's get started. The intention of the webinar, as always, to keep you informed on COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is to leave the webinar motivated to create or improve an action plan for you or your family. It's also motivated to create an action plan for a broader community, like a homeowners association or a church or a business or whatever it may happen to be. I've added the wellness component to this presentation because COVID-19 has had a significant impact on our life expectancy. Life expectancy in the United States has gone down because of COVID-19, and that's why I've added a wellness component at the end of every webinar. All right, our CDC director is concerned that there could be an impending 4th wave as COVID cases increase. We have had, Michigan alone has seen a 60% increase in its COVID cases. Other countries that have preceded us have seen their COVID cases increase, as well as their hospitalization and their ICU admissions, and they are occurring with younger and younger patients. Many are unvaccinated. I know people ask me all the time, have I seen anybody vaccinated in the hospital with COVID-19? I have not. I have only seen unvaccinated people in the hospital with COVID-19. So unvaccinated Americans are driving the current surge in the coronavirus pandemic. Globally, there's been 139 million cases of COVID-19 and just shy of 3 million deaths. By tomorrow morning, it will be 3 million deaths from COVID-19 worldwide. And that is really, really a lot of people. In the United States, we've had 32 million cases of COVID-19 and just shy of 600,000 deaths, specifically 816 deaths. We can't let our guard down. This is the time to really stick with your routine. I know even for myself, for a little while there, I think I was fairly good with masking, but you know, I washed my hands a lot at work. But was I washing them as frequently when I came at home? Not necessarily. You know, there was a week or so where I couldn't find my hand sanitizer in my car. And so I just kind of reloaded everything, you know, put my hand sanitizer in my car, put the gloves in my car. And just make sure that you don't let your guard down as we go into this last phase, whether or not you're vaccinated or not. Dr. Fauci described COVID-19 as an extraordinary virus. He used the word extraordinary for several reasons. One, it is a virus that has an asymptomatic period, and during that asymptomatic period, it can spread from one person to another, usually Viruses only actually spread during the times that people are symptomatic. The other reason it is extraordinary virus is it uses younger people as a host, and that it impacts and kills the vulnerable population. And the last reason why it's an extraordinary virus is that we don't really have any medications that cure it, and it also seems to be mutating and presenting differently and getting stronger. New study found that Black women are 3 times more likely to die from COVID-19 when compared to white men. I also mentioned to people that actually Black men die at a rate that's higher than even Black women. So when we look at this, this impacts minority populations disproportionately. And again, we're not exactly sure why at this point in time. Some of it may be related to comorbidities and the presence of comorbidities. Other things may be related to blood type. There's all sorts of things, access to healthcare. There's all sorts of things that can kind of make a difference with this. As we said, respect COVID-19. It's highly contagious. Minimum time of exposure to infect others is 45 seconds. And that is with the original COVID. The variants take less than 45 seconds. And 60 to 80% of the people who come in contact with COVID-19 actually convert and become positive. This is a little bit about how it gets into your cell. The viral RNA is embedded on the inside. There's a fatty layer on the outside, which is the red, and that includes spike proteins that actually spike off the fatty layer. Those spike proteins attach to the receptor. That is the lock and key that unlocks and opens up the cells, moves into your cell. Then on the ribosomes, the RNA actually begins to duplicate and make the virus, and it makes the fatty coating, and it makes the spike protein. It forms another virus completely, and it heads back out again. And it does that over and over and over again. You have over 1 trillion cells in your body. Some people come in with COVID-19 and they say it feels like their entire body is on fire. And that is basically the virus infecting the body all over. The greatest concentration of COVID-19 virus has been found in brain cells, not in the lungs, and it is, as I said, all over the body. Dr. Fauci said that making the decision to actually develop the COVID-19 vaccine was the best decision that he has ever made in his career, to really convince the government to put the money behind it and actually develop the vaccines. So let's talk about the vaccines. So Pfizer and Moderna, we know about those. They're 2 doses. Messenger RNA is coded for the spike protein. The body then recognizes the spike protein, recognizes it as foreign, develops antibodies and attacks it and kills it. Now your body's ready when you see COVID-19 in the community. So because of this is why you actually sometimes get sick with your second shot. I got a call from someone from our community today who's at home sick from the second shot. And I remind people that that is your immune system working. When it recognizes the second shot, this is something foreign, it actually builds an immune system against it. You'll get a fever, you'll get some slight headaches, you may just get a little fatigue. Everybody's a little different. The Johnson & Johnson vaccine, which you've heard a lot about, is an adenovirus approach, which is a common cold altered to become harmless and attached with some genetic material from COVID-19. The combination teaches the body to generate antibodies and attack the spike protein so the virus cannot attach, and it renders COVID-19 harmless. Now, originally, we had Pfizer and Moderna that were approved for emergency use authorization, both being 2-shot regimens with 94 and 95% effectiveness. There was no deaths from either vaccine associated with the COVID-19 infection. Then we had Johnson & Johnson, and that has recently been paused. And Johnson & Johnson was a 1-dose vaccine. Now, I want to remind everyone that the last the last company on the list, which is Janssen at the very bottom. Janssen owns Johnson & Johnson. So the Janssen protocol was a 2-shot protocol of the Johnson & Johnson. So that protocol is also going to be impacted by the pausing of the Johnson & Johnson vaccine. The AstraZeneca vaccine, which also has an issue with clots, I don't think that they are going to apply for or get emergency authorization. I think they've already been told, we looked at your data and it's not going to be possible. I think that the next thing that we will see is Novavax, possibly, which is also a 2-shot regimen that will apply for emergency use authorization. So let's talk about this Johnson & Johnson vaccine over clots and what has been the issue. So it is paused because there were 7 million people. 7 million people have gotten the vaccine, but 6.8 specifically. And 7 people have had problems with clots. Now, a lot of people think that's irresponsible to actually, for something that's 1 in a million, why are you actually pausing it? So I want to go over, it actually is really important that this be paused. So this slide says 6 cases. My understanding is there was a 7th case. But the 6 cases were women between 18 and 48. The 7th case that they're investigating is I believe, is the male. But these were a severe type of blood clot that was also associated with a low platelet count. So normally, when we actually treat a blood clot, we would treat it with heparin, or some type of medication that actually dissolves the clot. What we have found is that what happens with this is when you actually treat these clots with a normal medication, then what happens is the clot actually gets worse. So part of what's going on here is, one, to alert physicians to this so that they're aware that these clots have to be treated differently, because you don't want physicians, even if it's 1 in a million, to be treating these things incorrectly. So I think it will probably be paused for a couple of weeks until they actually get physicians educated. All right, COVID-19 variants. I just wanted to show a couple here. As you'll see, all the variants come from hotspots. So variants occur when the virus gets to replicate over and over and over again, and it does millions and millions and millions of replication, which then allows it to become better. So the virus is always trying to become better. It's always trying to become more infectious. It's always trying to live longer, and it wants to infect more people and live in more hosts. So, and it becomes usually increased transmission. And also what it does is it may or may not work with certain therapies that we have. So the UK variant is 50% more transmissible, but it's still sort of the monoclonal antibodies and the vaccines seem to work. Japan and Brazil, less effective with the monoclonal antibodies, and it does seem to reduce the effectiveness with some of the vaccines. South African variant is similar. The U.S. California one, specifically the 1.427, has a significant impact on neutralization and a moderate impact on vaccination. Similarly, the other California variant, B.1429. So this is why it's really, really important that all countries work together to help other countries stamp out the virus. Because once a variant is made or created, it can then begin to infect the world. So you really want to actually have all the countries pulling together to actually resolve this. So the Pfizer vaccine may be less effective against the South African and UK variant per an Israeli study. You will find that most of the really good data on vaccine effectiveness and also whether or not you can transmit the virus while you're vaccinated is going to come out of Israel. Israel has done a very good job of vaccinating its Jewish Israeli population. Less good of a job with the Palestinian Israeli population. But they have also done a lot of very good scientific studies, and they have exchanged their scientific studies to make sure that they actually get access to more vaccines. So a lot of people have asked, when are you fully vaccinated? You're fully vaccinated 2 weeks after your last shot. So that is important. That is when you are fully vaccinated. Now, what can you do when you're fully vaccinated? You can be indoors without wearing a mask and staying 6 feet apart with other fully vaccinated people. I think right now the CDC recommendation is 4 to 6 people indoors. So you can visit other vaccinated people, as long as it's not a large crowd, as long as it's small, 4 to 6 people without wearing a mask, as long as everyone's vaccinated. Now, if you have unvaccinated people that you're going to meet with indoors in any indoor setting, it would be important to wear a mask. You also don't have to quarantine or test if you do not have symptoms of COVID, but you come in contact with someone with COVID. Now, what do you still need to do being fully vaccinated? Still wear a mask indoors, like if you go to the store, etc. Stay 6 feet away from people that you do not live with. Avoid medium and large size in-person gatherings. Get COVID tested if you feel like you have symptoms, and you should follow the guidance of your employer and health department around travel. Now, here's what's happening is we have a second cruise line now requiring vaccines. And I think that you will see this, and it will probably occur because a lot of countries are going to require vaccinations. So it'll be similar to almost having to have a passport. So we have a second cruise line now that is actually requiring vaccines. Brazil, Mexico, and the Philippines are actually going to get the Pfizer shot from COVAX, which is a World Health Organization, and COVAX is in conjunction with the World Health Organization, and it is set up to attempt to vaccinate about 15 to 20% of a country's population. So they are due to get vaccinations, those 3 countries. Brazil is having a particularly hard time. They are having thousands of people die per day. The hospital system there, they're saying, is collapsing. They're saying that people are actually not even getting to a physician. They're not getting out of the waiting room. They've had 1,800 deaths. They actually used a Chinese vaccine, which has been found to be only 50% effective against the variant. So I think that's why COVAX is now sending them the Pfizer vaccine. Foreigners flocked to Serbia because Serbia said, come on over, you can get the vaccine. Now, Serbia is actually giving, since Serbia is in Europe, they're actually giving people the AstraZeneca vaccine, which is not approved for use in the in the United States. Other small countries like Papua New Guinea are having problems with COVID infections and just not enough physicians. So we're seeing other countries provide medical support. This is also a study that is going on now, and this is to actually look and see, does the vaccine stop transmission? I get asked this question all the time. So they're recruiting college students and giving them the Moderna vaccine and then testing them for COVID to see whether or not the COVID vaccine actually stops transmission. To date, we have actually administered just shy of 200 million vaccines. And let me just say, that is actually phenomenal to consider that, we started basically at the beginning of the year. 200 million vaccines. Now, that's not going to be 200 million people fully vaccinated because, again, the Moderna and the Pfizer vaccine are 2-part vaccines. But if you have 200 million people vaccinated, you certainly probably have at least 100 to 125 or 150 million that are fully vaccinated. So that is just, that is really, really great. 40% of the Marines have declined to receive a vaccine to protect against the coronavirus. This is really, really unfortunate. I saw a patient just recently who had refused the vaccine, who was elderly, and we had to admit her. I have another friend who has a coworker who refused the vaccine and is now still sick and on oxygen. So, it's just, I tell people really reevaluate this decision to not get vaccinated. A lot of people say, well, what should I say to my friends that are hesitant to get vaccinated? So one is, don't make them wrong, or don't talk down to them, or don't make them feel foolish. They have legitimate concerns, and you want to be a place where they can actually talk through their legitimate concerns. So a couple of things. I would encourage them to talk with their doctor. Have you talk to your doctor about, whether or not you should get vaccinated and what your physician thinks. That's somebody that you selected and that you trust their health opinion. Otherwise, you wouldn't have selected them as your physician. You can also remind them that qualified people are studying the vaccines. Remind them that medical professions not only stand by it, but have actually gotten it. I tell people a lot of times in a pandemic, look at what the medical professionals do, right? And when COVID first hit, the medical professionals were very concerned about COVID-19, and were probably some of the first to start masking. So I tell people, follow the physicians and the nurses, and you will usually be in fairly good shape during a pandemic. I also remind people that getting ill from COVID-19 is more serious than vaccine reactions. Vaccine reactions might be annoying, they might be uncomfortable, but it's better than actually getting COVID-19. For some people, it's important to point out that they need to really help protect others. If they live with an elderly family member, or they have people with comorbidities. And then lastly, some people are motivated because they just want to get back to life more quickly. And that may be a motivating factor. Don't you want to go on a cruise or a trip, or kind of get back to life? This doesn't seem, COVID-19 is not going to disappear, right? This is going to be something that we're going to be dealing with. Some folks want to laminate their vaccine card. I actually laminated mine. I did that after I completed my immunization series, and I verified that the information on the card was accurate. And I also made a front and back copy of the card and saved that. And then I went in and got it laminated. So that's what I did for myself. Dr. Birx actually did an interview with Sanjay Gupta and said that after the first 100,000 deaths, deaths after that could have been mitigated. I think it's very unfortunate that that these mitigation measures were not put in place to actually save almost 500,000 American lives. There is now a hotline. I know there was a website at first for FEMA's COVID-19 funeral aid. There is now a hotline that you can actually call to actually get the funeral aid from FEMA if you have had a friend or family member that has been impacted by having someone in their life die from COVID-19. They do require that the death certificate references COVID-19 as a cause of death. All right, so let's switch gears a little bit. All right, so we're just gonna go into our wellness topic for tonight. And this was something that I was asked to do. And I was also asked to do family trees and genetics. So I'm going to do kidney stones today, and then next week I'm going to do family tree and genetics. But so tonight we're going to talk about kidney stones and how do we prevent them. This is important. So a kidney stone is also called renal calculi, nephrolithiasis, or urolithiasis. Those are all kidney stones. And basically, they're hard deposits of minerals and salts that form inside your kidneys and then get stuck. So they most commonly occur in men. 11% of men, well, 6% of women will have a kidney stone at least one time in their life. And sometimes you will, sometimes you will find that some kidney stones can get so severe that they can backlog and cause some type of kidney damage. So who's at risk? The people who are at risk are people who have gout or inflammatory bowel disease. They had a previous kidney stone. They may have a family history of kidney stones, or they're chronic users of antacids, particularly antacids that have calcium in them, right? And I would add one more thing to this. I'm going to add one more thing to this slide, which is a poor diet. So there are certain things associated with your diet, and we'll go over that. All right. So now, what are the complications? So one of the main things that happens with kidney stones is they cause severe pain. Men come in and say they feel like they're having a baby. So it's usually the worst pain they've ever had in their life. Also will cause blood in their urine. So it's kind of scary. It can also be, you can also get urinary tract infections. You can get loss of kidney function and damage, all related to a backflow of urine. So this is sort of what it looks like. So your kidneys are kind of in your flank area, right underneath your rib cages. And they have, they're connected to your bladder by what's called a ureter. And that ureter is actually where the kidney stones actually get stuck. And then when the kidney stone passes, it usually passes into the bladder. And from there, it pretty easily passes on out the urethra, right? But it gets stuck in the ureter. So it gets stuck in the area in between the kidney and the bladder. And that's why people often have back pain, etc. Now, not all kidney stones are the same. It is important that you know the type of kidney stones you have. People say, how can I prevent my kidney stones? I said, well, I don't know. What kind of kidney stones did you have? They go, I don't know what kind of kidney stones I have. Well, you probably do. It's in your medical record. The doctor gives you a strainer, and then you normally take the kidney stone when it passes into your doctor's office, and they normally do a testing or a typing on it. So these are the different types of kidney stones, and this is what they look like. So the calcium oxalate kidney stone is the most common kidney stone. That is probably, I would say 70% or so. And it's usually men in their 30s or 40s, and that shows you a picture of what it actually looks like. The calcium phosphate is another type of kidney stone. It can kind of occur with people that have an overactive parathyroid. Uric acid kidney stones, they're usually kind of diamond shaped. You'll see these in people with gout, diabetes, inflammatory bowel disease. The struvite kidney stone is a very it's a large kidney stone. You'll see this in people that have infections or that have some sort of bladder disease related to paralysis. And then lastly is the cystine kidney stone. And that is often associated with a familial disease called cystinuria. So now, this just kind of shows, just as you kind of get an idea of, you know, what zone are you in as far as acidotic or alkaline when you actually get kidney stones. And again, the calcium oxalate stone is the most common type of kidney stone. So now, this is kind of what happens is that, you know, the kidney stone forms, the calcium oxalate stone forms when you have low levels of citrate and high levels of calcium in your urine, right? So there's foods that are linked to that, right? And so think about potatoes, nuts, chocolate, spinach, beets, and black tea. Usually potatoes is a major source. Calcium phosphatate is another type of stone, and it really requires a lot of blood and urine tests to really determine if this is the sort of stone that you actually have. Struvite stones, the larger ones, are actually more common in women, and they're more common with urinary tract infection. They're also more likely to become very large stones, and they usually are very difficult to pass on your own, and these actually usually do require going to the operating room. Uric acid stones are more common in men. We often see it with people that actually don't drink enough water, and also people that have a meat and potatoes diet. Okay, so I tell people, for the men that are like meat and potatoes and are not drinking enough water, that is a setup for a uric acid stone. You can also see it with people that actually have gout, or a family history of kidney stones, or people who have taken chemotherapy. Lastly is the cystine stones. This one is hereditary. So this is one where there's a hereditary dysfunction that allows for a lot of this chemical called cystine to collect in your urine and actually cause kidney stones. So what is it that you need to do to prevent them? So one, drink at least 3 to 4 liters of water daily if you're prone to them. You want to exercise regularly. You want to maintain your calcium intake, but you want to make sure that you're not overindulging in anything that's calcium. I tell people, limit meat and potatoes specifically, and even white potatoes, sweet potatoes, all sorts of potatoes. You also want to limit the amount of alcohol, sodium, sugar, and salt in your food. If you look at a table of things to avoid, these are things that actually are associated with kidney stones. Nuts, seeds, beans, wheat, bran, black tea, as I said, all sorts of potatoes, any sort of potatoes, any sort of yams, and also your meats. So if you have kidney stones, you really want to have more of a diet that might be more of sort of like a fish and vegetable sort of diet with lots of fluid. It's not that you can't eat meat, but you just want to really limit it to maybe once every 2 weeks or so. All righty, we are going to go to QA.